But the questions that I always ask are, number one, do you experience any difficulties with leakage of urine, even a tiny amount, when you don't expect it? Okay, I do not ever say urinary incontinence, because when people hear that phrase, what they think of immediately is, oh, I'm standing in a puddle when I sneeze. And even a small amount of urine leakage tells me that the muscles are not functioning optimally, which is why I care about urine leakage. The second question I ask is, I pull out something called the Bristol Stool Scale. Feel free to just Google that. There's I don't even know how many options for quick and easy things that you can print online. But the Bristol Stool Scale is just it's pictures. It's not like camera pictures, it's drawings, but it shows different types of stool. And I ask them, just show me on this what your stool typically looks like when you go to the bathroom. And the reason I do that, instead of saying, do you experience constipation, is because people think, oh, constipation means I don't go every day. You can actually be constipated and go every day. And so what the Bristol Stool Scale shows you is there are several kind of ways that stool might appear that are within the realm of normal and not constipated. And then there are other ways that it can appear that indicate constipation. And most of us have only ever seen our own stool, unless we maybe have a very young baby and we're changing their diapers or something. But for the most part, people don't really have a frame of reference for what stool is supposed to look like. So that is a very helpful tool. And then the other question that I always ask everyone is, have you experienced any difficulties or discomfort when participating in intimate activities with another person or with yourself? And if people so the one thing that I will often suggest as a way to sort of get accustomed, now I'm very used to just spitting out those questions. I don't even think about it anymore. But if you're sitting there going, gosh, I mean, this makes sense and I'd like to start doing it, but that feels like a really big gap for me to bridge, or kind of a big thing for me to start asking about these things. If you do intake paperwork, you can absolutely put these questions on your intake paperwork. And then and just say something like, circle any of these that apply to you, or you put the picture of the Bristol Stool Scale on there and just ask them to circle the one that applies to them. And then if they circle yes about the sexual dysfunction, or if they circle yes about leakage of urine, then they open that door in a way, and you can just say, oh, I see you circled this. Could you tell me more about that? And then at that point, you'll want to know things like, well, are they having urine leakage when they're doing things? So running, jumping, laughing, sneezing, coughing, that means the muscles are not working ideally. Are they just leaking all the time? That's a symptom of a neurologic dysfunction, and so on and so forth. And we go into quite a lot of detail with that in that orthopedic pelvic health course that you're referencing, which can be taken online as well as in person, by the way. So those are my screening questions.